Hello, my name is Carolina Tesi. I'm from Block G, and this is my health assessment case study number 2 video. I'm going to start with the room tour. So this is my room. My video person, the ceiling, and the floor. So I'm just going to start by washing my hands, cleansing my equipment, and donning my gloves. Hi Dan, my name is Carolina Tesi, and I'm going to be your student nurse for today. It says in the health assessment document that you are 55 years old and you've been experiencing limited ROM in the upper extremities and neck, increased shortness of breath, ear pain, as well as a sore throat for 3 days. Is this correct?
Yes.
Okay, and do I have your consent to continue this health assessment?
Yes.
Okay, so I'm just going to start by asking you a few questions. So question number 1. How much pain do you feel on a scale of 1 to 10 in your arms and neck? Question number 2. Do you cough up phlegm? If so, what color? Question number 3. Do you experience chest pain with your shortness of breath? Question number 4. In terms of your shortness of breath, how often do you feel short of breath and at what times in the day? And question number 5. When did this ear pain start? So now I'm going to begin examining the ears. So as I examine the ears and inspect them, I can see that they are symmetrical and there is no abnormal discharge coming out of them, which is a good and normal finding. And as I palpate the auricle and the tragus, I can see that she says there's no pain, which means there's no tenderness, which is a normal finding. I'm going to do the whisper test now.
Back. Perfume. Purse. Mirror. Bed. Toy.
Okay, so she passes the whisper test. So now I'm going to move on to the nose. The nose is midline, which is a normal finding. However, there is nose flaring, which is abnormal. And as I palpate the frontal and maxillary sinuses, she says there is no pain but mild pressure, which is a normal finding. So now I'm going to move on to the mouth. I'm just going to grab my equipment. So starting with the lips, I can see that there's no edema present, which is a normal finding. However, there is slight cyanosis, which is abnormal. And now I'm going to look into the mouth. And when I examine the gums, I can see that there's no bleeding and no lesions, which is a normal finding. In terms of the teeth, I can see that all 32 teeth are present, and there are no cavities, which is a normal finding. And in terms of the tongue, I can see that it is well hydrated with no lesions, which is a normal finding. And in terms of the soft palate and hard palate, I can see that it is pink in color, and there are no visible lesions, which is also a normal finding. So now I'm going to test cranial nerve number 9, the glossopharyngeal nerve, and cranial nerve number 10, the vagus nerve. So I'm just going to get you to say, ah, ah. Okay, so these nerves are intact since her soft palate and her uvula rise. Now I'm going to test cranial nerve number 12, the hypoglossal nerve. So I'm just going to get you to rotate your tongue side to side. Okay, now say light, tight, dynamite.
Light, tight, dynamite.
Okay, so this tells me that this nerve is intact since there's no visible tremors. So now I'm going to move on to the neck. So when inspecting the neck, I can see that it is symmetrical. There's no obvious enlargement of the thyroid. It is proper color for the rest of her body. There's no it's a proper head position, and there's no lesions or visible masses. So now I'm going to palpate the carotid artery for one at a time for 1 minute. And as I do this, I can see that the pulse rate is 104. There's an irregular rhythm, and the strength grade is a 3 positive, which are all abnormal findings. Now I am going to test cranial nerve number 11, the spinal accessory nerve. So what I'm going to get you to do is try and fight resistance. So you're just going to, yep, okay. Now the other way, push, okay. Now you're going to shrug your shoulders, Okay, so she struggles to fight resistance, which is an abnormal finding, and this needs further investigation. So now I'm going to move on to the integumentary system. So I'm just gonna look at her arms. So when I observe her arms, I can see that there are no visible masses, there are no lesions, no edema, and no involuntary movements. And as I palpate this, however, I do inspect diaphoresis, which is an abnormal finding. And as I palpate the skin for temperature, I can feel that it is abnormally high, and I can also feel excessive moisture, which is abnormal. However, I do not notice any masses as I palpate, or I do not feel any lesions, which is a normal finding. So now I'm going to examine the nails. So when I examine the nails, I can see that there are no lesions, which is a normal finding. However, capillary refill is sluggish, which is an abnormal finding. Now I'm going to test ROM. So just repeat after me, starting with the fingers, flexion, extension. Okay, fingers are normal. Now the wrists. Extension, flexion, radial, and ulnar deviation. Okay, now wrists are normal. Elbows, flexion, extension, pronation, supination, normal. Okay, now shoulders. Abduction, adduction, okay, external rotation, internal rotation. So I can see that all her ROMs are normal except for her shoulder ROM, which is abnormal, and I noticed crepitus and pain while she was doing these movements, and she was unable to do some of these movements. So now I'm going to test her radial arteries, so just hold them up, okay? Now I'm gonna go on the thumb side. So as I do this, I can see that there's tachycardia, an irregular rhythm, and which are abnormal findings. However, there's an even equality. And as I do the same thing for the brachial pulse, I can note tachycardia and an irregular rhythm, which is abnormal. However, I do note even equality, which is normal. So now I'm going to do the hand grip test. So just squeeze my hands. Okay, so it is symmetrical bilaterally, which is a normal finding. So now I'm going to move on to the back and the thorax. So just turn this way. Yeah. So as I examine the back, I can see that it is symmetrical. There are no skeletal deformities and no lesions. However, I do note diaphoresis and excessive moisture, which is abnormal. Now, as I palpate the skin, it is the normal temperature. The temperature is above normal, which is abnormal. However, I do not feel any masses, which is normal, and I do not feel any lesions, which is also normal. But I do note excessive moisture, which is abnormal. Now I'm going to percuss, and before I percuss, I can see that the AP transverse ratio is 1 to 2, which is normal. Now I'm going to percuss at all 9 points. So 1, 1, 2, 2, and I'm looking for resonance, and the resonance is hyperresonance, which is abnormal. So now I'm going to auscultate at all 9 landmarks, and I would continue the percussion for all 9. So deep breath in and out. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, 9. And as I do this, I note tachypnea, irregular rhythm, and poor quality of respirations. I also note crackles and wheezes, which are abnormal findings. Thank you for listening to my health assessment.